Welcome to your4state.com's Medical Corner. I'm Lynn Lawson. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you, Lynn.
And our question for you, what is the importance of diabetic foot care?
Well, diabetic foot care protects the feet in people with diabetes, so it prevents problems from occurring. Diabetes affects a lot of people in our country, and when you have diabetes, you get problems with your feet because diabetes takes out your immune system, it takes out your nerve function so you can't feel your feet, and it takes out your blood supplies so you don't get blood down to your feet. And those three things are really tough on feet. So to combat this, we recommend everybody with diabetes come see a foot specialist. And what we do when you come see us is we assess your feet to make sure you don't have any problems. A lot of our patients don't have these problems because we prevent these things from happening. And a very simple way to do that is using diabetic shoes. And diabetic shoes are different than other shoes because they have extra depth, so there's extra layers of padding. You can see the insole here. Some of the diabetic shoes that we have a special insole that on the bottom has a pressure relief system. These little gel things come out, so if you have a callus underneath one of your toes, you can take this little gel thing out and it will take the pressure off and your callus will go away. Calluses are bad because they are the first sign of too much pressure. And if you have a callus, then you can get an ulcer, and that is a problem. So we want to prevent that. And by utilizing these shoes, which are covered by most insurance plans and Medicare, you can prevent a lot of foot problems. In addition, there are several tips that you can do. You want to come see a foot specialist at least once a year, if not twice a year, just to make sure everything is okay with your feet. You want to wear synthetic socks so you don't have too much moisture in your shoes. Cotton socks aren't that good. The color doesn't matter of the sock, it's just the material. So you want a synthetic material sock so it wicks away the moisture. You want to put lotion on your feet. You want to keep your feet healthy. And if you ever see something wrong with your feet, you need to come by and see a foot specialist to make sure that we can prevent anything from happening. You don't want to do bathroom surgery either. A lot of people see something with their something wrong with their foot and they start cutting and doing stuff in the bathroom, and that can be a real problem for people. So if there's something wrong, don't try treating these things yourself. Saltwater soaks and Band-Aids aren't going to usually cure the problem. They can make it worse. Antibacterial ointments aren't going to help either if you have a sore. You need to come by and be seen, and the sooner you do that, the sooner we can fix it and prevent it from getting worse.
Thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your4state.com.